Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi, and on this episode, we are going to dive into a topic that affects a lot of people throughout the world. So, what we're calling this is an extreme dive into hypothyroidism. So this will be we'll say your go-to resource for the most comprehensive information on this complex topic. So when we talk about hypothyroidism, we're going to talk about what it is, how it works, and how it impacts the body. Hypothyroidism is one of the most common hormonal disorder worldwide, and yet many people don't realize how intricate and interconnected it causes its and treatments. They don't realize how interconnected everything is, and we're going to help break that down. So let's start breaking it down. So first, what is hypothyroidism? So hypothyroidism is often referred to as a underactive thyroid. This condition affects obviously the thyroid gland, and it causes the thyroid gland to not produce um, doesn't produce enough hormones, which are crucial. So let's get into the definition and some anatomies of it. So the thyroid gland itself is a butterfly-shaped gland located at the front of the neck, just below the Adam's apple, approximately here. It plays a key role in regulating your body's metabolism, energy production, heart rate, and even balances temperature. Specifically, it produces hormone called thyroxine, which is called T4, or trio I'm going to try to say this, trioiodothyronine, which is T3, which we'll say T3 from now on. So T3 acts as a messenger to instruct organs and tissues how to function efficiently. Who is affected by hypothyroidism? This disorder affects approximately 5% of the general population, though subclinical hypothyroidism is an early or borderline form that affects the closer to 10% of the population, especially in older women. It's worth noting that hypothyroidism is far more common in women, likely due to hormone influences from estrogen levels, pregnancy, and menopause. Globally, iodine deficiency remains the major cause of hypothyroidism in areas where iodine is scarce. But in developed nations, autoimmune conditions like Hashimoto's, thyroiditis are the leading culprits. So let's get into the anatomy of the thyroid system. The thyroid gland secretes T3 and T4 to regulate metabolism. The pituitary gland, often referred to as the master gland, it releases thyroid stimulating hormone, better known as TSH. When it produces TSH, it promotes the thyroid to produce T3 and T4. So if you have high levels of TSH, obviously that's going to tell the thyroid to stop producing, and you're going to end up having low levels of thyroid production because of that. So hypothalamus regulates the pituitary gland and releases thyrotropin releasing hormone TRH to communicate the hormonal needs. Hypothyroidism disrupts this system. So when the thyroid underproduces its hormones, the pituitary gland compensates by sending more and more TSH to stimulate the thyroid. If the thyroid is unable to respond effectively, this leads to elevated TSH levels. And this is typically a hallmark of hypothyroidism. Additionally, suboptimal thyroid hormone levels can affect the balance of other hormones, including estrogen and testosterone, which exacerbates symptoms like fatigue and changes in mood or libido. How does the pituitary gland get affected? So, a poorly functioning thyroid can stress out the pituitary gland by pushing it into overdrive. Over time, this can result in dysfunction of the pituitary itself, especially in cases where underlying conditions like a pituitary tumor or a complication from hormonal imbalance, they're all in play. So your next question is, well, how do you get it? So the most common causes of hypothyroidism is, and we'll go over the top 7. Autoimmune disorder, so that's the leading cause of hypothyroidism. In developed nations, Hashimoto's thyroiditis. So Hashimoto's is an autoimmune. Autoimmune condition means the body attacks its thyroid tissue. So autoimmune means the body's attacking itself, basically, for the thyroid. The number 2 reason is iodine deficiency. The thyroid depends on iodine to produce T3 and T4. So a lack of iodine in the diet can lead to hypothyroidism. Thyroid surgery is number 3. Removal of part or all of the thyroid gland for cancer or other conditions can be the reason why. So they're going to, if you have cancer, they're going to obviously remove it. And what they're doing now is if you even have suspect cells, a lot of doctors are taking the thyroid out to prevent you from getting cancer. You can get hypothyroidism from radiation therapy, treating thyroid cancer or other head or neck cancers can damage the thyroid tissue. Medications can cause hypothyroidism. Drugs like lithium or amiodarone can interfere with the thyroid function. Number 6, congenital hypothyroidism. Some people are born without a fully functioning thyroid gland, and therefore you're going to have hypothyroidism. Lastly, number 7, secondary hypothyroidism, caused by issues with the pituitary gland or hypothalamus rather than the thyroid itself. So it's not really the thyroid, it's everything else that makes the thyroid function. Okay, so next part, let's talk about symptoms and diagnosis. What are some of the symptoms? How do I even know if I even have it? So with hypothyroidism, some symptoms can really sneak up slowly on you, while others are more prominent from the start. So, for example, a lot of times you're going to have fatigue. You're going to feel tired all the time. You'll wake up, you have a great night's sleep, and you're still tired. Weight gain. You might be on trying to diet, control your weight, and you're reducing calories, you're doing everything you can, and you're still gaining weight. That could be a cause of it, hypothyroidism. Cold intolerance. So at one point, you were okay with 72 degrees in your house, and now you're raising it to 74, 75 because you're cold. Basically, you're getting cold much, much faster. Your body's ability to regulate your internal temperatures is dysfunctional. You have dry skin and dry hair. You could have hair loss. You could have patches of hair pop out. Depression and mood changes. Constipation. Slow heart rate. Puffy face or swelling. Hoarseness in the voice. These are all potential symptoms of hypothyroidism. Now let's talk about subclinical hypothyroidism. So some people with subclinical hypothyroidism might have very mild symptoms or none at all. When they present, they can present as decreased energy levels, subtle cognitive dysfunction like brain fog, slight weight gain, elevated cholesterol. All these little things here add up. And if you're having any of those symptoms, you really should get evaluated by your primary care or an endocrinologist to determine if this is affecting you. So, how does somebody diagnose hypothyroidism? So, the best way to really diagnose it is blood tests. Obviously, you're going to take a great history. You're going to get all your information. You're going to understand, okay, patient has A, B, C, and D of the symptoms that we just mentioned, but ultimately we're going to look at blood test. Your TSH levels elevated in hypothyroidism due to the pituitary compensation. So the pituitary is working harder. It's pumping the T3, pumping the T4, and then it's raising the TSH levels. Another test that we're going to look for is free T and free T4 and free T3. These thyroid hormones are reduced in severe cases that can appear normal in subclinical cases. Sometimes it is warranted to image the thyroid to investigate the structures and see if there's any abnormalities or nodules or extra growths. So let's talk about treatments now. Conservative treatments, non-medical approaches. Conservative treatments focus on dietary and lifestyle changes. First, iodine supplements. For individuals in iodine deficiency regions, that would be one of the things that you would want to look at. Dietary modifications, including selenium, zinc, and iodine-rich foods like seafood, eggs, and dairy products. Exercise. Regular low-impact exercises can combat fatigue and weight gain. It's not going to affect the thyroid, but it's meant to help with reducing weight gain and reducing fatigue. Stress management practices like yoga and meditation can help balance your hormone or your stress levels. Non-conservative medical treatments. Standard therapy for hypothyroidism involves levothyroxine, basically Synthroid. Synthroid is a version of T4 hormone. Once ingested into the body, converts it into T3 as needed. Other medications that are out there. NDT, which stands for natural desiccated thyroid, derived from pig thyroids containing both T3 and T4. Liothyroid, which is cytomel. It's a synthetic T3 hormone, sometimes paired with T4 for better symptom control. Combination hormone therapies. These cater to individuals who don't respond well to Synthroid. Comparison with estrogen and testosterone's roles. Let's talk about this for half a second. High estrogen levels can reduce thyroid hormone availability in the body, especially in pregnant women or women undergoing hormone replacement therapy. So if you're taking estrogen, there's going to be a link that can affect your thyroid level. So it really has to be monitored carefully by your functional medicine doctor. Testosterone. Low testosterone levels can contribute to fatigue and muscle weakness in men with hypothyroidism. Okay, let's break down a little bit more subclinical hypothyroidism. So typically subclinical hypothyroidism often appears as a borderline low energy or mood changing with TSH levels elevated. T3 and T4 levels are usually normal. Treatment. Not everyone needs treatment for subclinical hypothyroidism. Managing depends on age. Older adults are less likely to be treated. Cardiovascular risks like cholesterol. So hypothyroidism can raise your cholesterol. and symptoms that impact the quality of your life, right? So if you have low mood, if you have low energy and your mood is up and down, that can be a direct link to hypothyroidism. Many doctors, though, will follow a wait and see approach with annual testing if symptoms are not debilitating. But going back, if you're on a hormone replacement therapy, and you're getting these symptoms, this is where you really need to see your doctor ASAP and really get yourself under control. Okay, so what's out there? What's new? What's the new research out there? There's exciting research in subclinical hypothyroidism suggests that the condition may play a pivotal role in development of cardiovascular disease, even in mild cases. So targeted therapy, scientists are exploring medications that are addressing the deficiencies in T3 and T4 conversion. Genetic studies, research into genetic mutations affecting the thyroid gland is helping us predict who might develop hypothyroidism. And a very new field that's research is out there, and we're going to get into this a little bit because anything functional I really enjoy. So we're going to talk about it. Peptides in hypothyroidism. Peptides are, so if you say, well, what's a peptide, doc? Okay. Peptides are short-chain amino acids that can act as a signaling molecule in the body, influencing various biological processes, including hormone regulation, immune function, and tissue repair. While peptides have gained popularity in regen medicine and chronic health management, their direct use in treatment of hypothyroidism is still an emerging area of research. Let's get into a little bit of what that research is. So hypothyroidism is often caused by an insufficient production of the thyroid hormone, or it's an autoimmune condition like Hashimoto's. Peptides might benefit by addressing the underlying issues like inflammation, immune dysregulation, or metabolic dysfunction. However, their role is indirect rather than a direct substitute for the thyroid hormone. So what that means is we're going to talk about the peptides, that their role is indirect, meaning it's not you're going to take this and it's going to cause this. So when it's indirect, meaning you're going to take this and it can do this, it can do this, and it can do this, and therefore it can do that, which is help with your thyroid. That's indirect. That was a very indirect way of explaining indirect. I realize that. I got that. But hopefully you get my point on that. Okay. So immune modulation in autoimmune condition of hypothyroidism. If it's caused by a autoimmune condition, peptides with immune modulating effects may help. So if you have Hashimoto's, there is peptides that might help. So the first peptide that might help is called TA-1, which is thymosin alpha 1. So it's a peptide known for immune regulation properties, helping balance immune responses by promoting T cell function and reducing inflammation. Might benefit patients with Hashimoto's by decreasing the autoimmune-driven thyroid damage and improving the thyroid gland function. BPC 157. So BPC 157 is out there all over the place in 2025 as it's getting accolades for a lot of different things. So it pops up here for this as well. So BPC 157 is a regenerative peptide frequently studied for wound healing and inflammatory reduction. May have an indirect benefit for the thyroid health by supporting tissue repair and reducing systemic inflammation. Could theoretically protect or repair thyroid cells in cases of chronic inflammation. Metabolic and hormonal support. Some peptides may support metabolic function and hormone signaling pathways, which could influence hormone production indirectly. So the first one that pops up is GH serotoculus, which is better known as CJC 1295 plus ipamorelin. So basically, it's a growth hormone releasing peptide that may help optimize your metabolism and reduce symptoms of hypothyroidism, such as your fatigue and low energy level. These peptides might indirectly support the thyroid functioning by improving cellular repair and enhancing mitochondrial activity. One of the last ones we're going to talk about is kisspeptin 10, which plays a role in hypothalamic signaling and hypothalamic pituitary thyroid, which is HPT axis, which governs the thyroid hormone production. It's still very early on and experimental stages. But again, we are under the heading of research. So all of this is what I'm talking about right now is research and very, very new information. Gut health and thyroid connection. Since the thyroid health is closely tied to gut health, gut healing peptides such as the BP157 and trizepatide might indirectly benefit individuals, which with hypothyroidism, improving nutrition absorption. And the vitamins that are key for hypothyroidism are iodine, selenium, zinc, vitamin D. What are the limitations of peptides for hypothyroidism? So big bold letters, no direct replacement, right? It is not a direct solution. Peptides cannot directly replace thyroid hormones like levothyroxine, or any other medicines that are out there, which remain the frontline treatments for hypothyroidism. Lack of evidence, right? Most peptides are being researched for their effects on inflammation, autoimmune disorders, tissue repair, and metabolism, not the thyroid gland itself. Experimental. Peptides are not FDA approved specifically for the thyroid treatment, although certain peptides such as um, TA1 are approved for other conditions, but they may be used off-label for hypothyroidism. If conventional treatments for hypothyroidism are insufficient or you prefer to explore adjunct or complementary treatments, then you need to consult with a functional medicine doctor or an anti-aging specialist that are familiar with peptide therapies. Peptides are not something that you can take lightly. It is not something you could take on your own. It is not something you should experiment by yourself. It is not something you should just be willy-nilly about. It is, even though it's indirect, it directly affects a lot of things, and you have to know what you're doing, which is why you need to go to a certified functional medicine doctor or an anti-aging specialist so you can get your proper medical evaluation on that. They are typically safe, but you really have to know where you're getting them, who's giving it to you, and how you're getting balanced. It's very, very important. So there is some research on TA1 and BP157 that's coming down the pike with hypothyroidism. And if that pops and comes out and it's positive, then I will do a follow-up podcast on that and give you that information as well. But there's a lot of research for a lot of different things coming out, and you just got to really be diligent and understand what you have and what's going on with you. So let me give you my final words on hypothyroidism. Understanding hypothyroidism means mastering the delicate connection between your thyroid, your pituitary gland, and hormones like estrogen and testosterone. This condition is a testament to just how interconnected our body systems are and how even small imbalances can have widespread repercussions. Whether it's subclinical hypothyroidism or a more advanced form, the key to effective management lies in tailoring treatment to your unique body. If you think you might be grappling with thyroid issues, consult your doctor for the proper testing and blood testing and personalized recommendations that he or she will prescribe. Don't let hypothyroidism go untreated. Your quality of life depends on it. Addressing this invisible but manageable condition head on is what you need to do. And as I say on all my videos, the information you received here is my opinion alone. It is not medical advice. It is not medical treatment. You need to see your own doctor to do your own testing, to do your own proper prescriptions for your own proper medications. This is just information that I have given you and my opinion. With that said, if you know anybody that has hypothyroidism, please pass this video along to them. Please hit the subscribe button, send this to your friends, send this to your cousins, send this to your aunts or uncles. Anybody who you think, all kidding aside, who could benefit from it, please, if one little piece of information benefited you or somebody, that is my goal. That's the point of me doing these, so I do my research and I give you all the information that I can find out there for the most up-to-date information. And if that can help you in any way, that's kind of why I do it, why I take the hours to do these. At the end of the day, what I always say is we only got one shot at this, and it's your health that matters. So your health matters. Till next time, DrChillemi out. Have a great day.